Hello and welcome to my channel. This is Isaac Simple. Thank you for tuning into my channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like, and share. This is a channel where I usually talk about issues concerning averting HIV and sexually transmitted infection stigma in our society. And we usually say that being positive about HIV is not necessarily being HIV positive. Thank you. Let's all engage, be positive of our own health, and be responsible of our own health. Thank you. Now, in our topic today, we are going to discuss about Mycoplasma Genitalium infection. Basically, this is a sexually transmitted infection that is usually caused by a small pathogenic bacterium that lives in the epithelial cells of the genital and urinary tract in humans. Are we together up to that point? Thank you. Now, how is this kind of infection spread? Basically, this kind of infection is usually spread via sexual intercourse, vaginal sexual intercourse. However, it can also be spread to the chorionic villi tissue, especially for the pregnant women, resulting to or potentially resulting to spontaneous abortions. Are we together up to that point? Thank you. Now, what are some of the clinical presentation of someone who is suffering from Mycoplasma genitalium infection? Basically, for the males, they will present with urethral discharge, that is usually mucoid. They may also present with pain while passing urine, may also present with testicular pain, may also present with lower abdominal pain and lower back pain. Are we together up to that point? Thank you. Now, let's go to the female presentation. For the females, they usually present with lower abdominal pain, lower back pain. They may also present with mucoid vaginal discharge. They may also present with pain while passing urine. And some may present with non-specific symptoms like dizziness. Are we together up to that point? Thank you. Now, let's go to the diagnosis of this kind of infection. Basically, in most healthcare settings, this kind of diagnosis is usually done clinically with good clinical examination and history taking by a qualified healthcare worker. A diagnosis of Mycoplasma genitalium infection can be made. This is because this bacteria is usually somehow different from other bacteria. Now, what is the difference? To begin with, this bacteria lacks a cell wall, and by this reason, it cannot be diagnosed via gram stain. It can also not be diagnosed via light microscope, which is very available in most healthcare settings in our society or in our country. Therefore, it can only be diagnosed using an electron microscope, or it can also be diagnosed using a specific test that we call NAT, or nucleic acid amplification test. Are we together up to that point? Thank you. Now, how do we go about treatment of this kind of infection? The first line treatment, we usually treat Mycoplasma genitalium infection using a class of tetracycline drugs that we call doxycycline, usually given a dose of 7 days, followed a dose of 4 days with a macrolide class of drug that we call azithromycin, usually 500 milligrams once a day for 4 days. Alternatively, for persons who are resistant or who have developed resistance to macrolide, that is azithromycin, alternatively, we can give you treatment with doxycycline for 7 days. Then you can be prescribed moxifloxacin, a dose of another 7 days. However, for those persons who are taking moxifloxacin, it's very necessary for you to take caution of the adverse effects or side effects. Some of them are very dire and permanent, including tendinitis and other presentation that you may experience that are not that are very severe. So if you realize any kind of abnormality or any kind of discomfort while taking this kind of medication, kindly do not hesitate to visit any healthcare facility for consultation. It could be a side effect of any kind of treatment. Are we together up to that point? Thank you. Now, let's go to the prevention. We usually say that prevention is better than cure. Now, to prevent this kind of infection, it's good to take early treatment, especially when a diagnosis is already done. Kindly complete your medication. This is one of the prevention of recurrence of this kind of infection. The other thing is when you're having sex with someone who you do not know their STI status, kindly use condom. And the last one, which is also very important, is if you have several sexual partners, reduce your sexual partners. This helps you to reduce the risk or the chances of you acquiring Mycoplasma Genitalium infection. Are we together up to that point? Thank you. This comes to the end of our topic today. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like, and share. Subscribe now. Thank you. Bye bye.